Well, on a more serious note, everyone, the number of people diagnosed with autism jumped sharply between 2008 and 2010. We told you last month about the study by the CDC. Researchers found that 1 in 68 children in the United States had an autism spectrum disorder. That is up 30% from 2010. And for boys, well, they are 5 times more likely than girls to have autism. 6 News anchor Lori Tucker is here now with tonight's Caring for Our Kids. Lori?
Kristen, autism spectrum disorder means more than slight language delays or maybe a little bit of trouble making friends. And joining us to learn more about this is Dr. Jan Neese, psychologist at Children's Hospital. Thank you for being with us.
You're welcome.
You know, first of all, explain what this disorder can look like, because there is that spectrum we talked about.
Right, and it does vary greatly among children, but the key components are that a child has difficulty with social communication, and they also have difficulty with repetitive movements or restricted interests.
It's not that easy to diagnose at first because it can really mimic some other things going on. So how is the best way to diagnose this?
The best way to diagnose it is to work with a professional who has experience in testing children with autism, and a thorough assessment would take a few hours, preferably over a couple of different days. It would also involve using an instrument called the ADOS, or Autism Diagnostic Observation Schedule. That's considered the gold standard test for autism assessment.
Just a checklist, if you will, of symptoms and things.
It's much more than a checklist. I think what I would caution parents not to do is to use just an internet checklist and try to diagnose it yourself.
That could be dangerous.
Definitely. You want to work with a professional.
Let's look at the signs, and I know we have those on the screen for you. If we notice that our child is maybe 2 years old, is that kind of when you can start seeing some of these things start to manifest? Let's go over this list for parents to look at.
Okay. Yes, trouble interacting and playing with others, and it's not just out of being shy. It's out of really almost missing that interest, seeming not to care or not to notice. Avoiding eye contact is definitely true for many children. Most children with autism have difficulty with eye contact. Unusual or repetitive movements can happen in children with other difficulties as well, but definitely that's a part of autism presentation. And for the youngest children, the significant developmental delays would include not saying single words by age 2, and not putting words together by age 3.
Okay, so you can really tell, you know what it's like if your child is behind other kids when they're in social situations. That's really where it can be glaring. Now, we talked about the spectrum. There can be children with severe autism, and then others who can do okay in society. So we don't want to be hopeless here. It's something you can live with and be productive.
And there are ways that most children who are on the spectrum, if they get treatment, and especially if they get it early, they can make really significant changes.
All right, Dr. Neese, thank you so very much for being with us. Early diagnosis, early intervention is the key here, and we want to make sure you let us know if you have something you want us to work on. Just give me an email shout out at ltucker@wate.com, and we'll look at what matters to you.